There's a couple of different terms that we use to basically describe this condition. The first is Herda, H-E-R-D-A, which stands for hereditary equine regional dermal asthenia. Another common name used for this is hyperelastosis cutis, or HC.
The condition affects only about 25% of horses who carry the gene.
One of the hallmarks is mushy skin. Basically, if you feel along the horse's back line in particular, you run into areas that are just very mushy. I don't know a better way to say it. It's actually fairly stretchy as well. Scars that don't heal properly. You know, scars on the body of the horse should heal very, very nicely. Scars on the legs can sometimes have problems with proud flesh or whatever, but body lesions tend to actually heal very well in horses, and in these horses they do not heal very well.
Dr. Rajmir and her team at Mississippi State University have been studying the condition for years. The biggest challenge is trying to identify horses affected by HC early on.
As far as horses that are affected, there are several things we can do. Biopsies actually can work in some individuals. It's not perfect, but it can help. And then analysis of the horse's pedigree. We understand the bloodlines pretty well of how the disease is transmitted, and so if they have a pedigree that's consistent with those bloodlines, then it actually acts, or it's a way to actually better determine if the horse has actually got it or not.
Once a horse is determined to have the condition, there are some things owners can do to help lessen the effects of Herda.
The best thing we can do is keep these animals out of the sun. We know that sunlight exacerbates the condition. Keeping them on a really high plane of nutrition, we actually address certain things that are important for collagen metabolism, like copper, vitamin C. We actually try and push those to the horse. Again, just an excellent plane of nutrition. Just management of the wounds that occur, and as they occur, managing trauma so that the horses don't get traumatized, if at all possible. Wash the horses instead of brush them a whole lot. Anything that can just minimize the trauma to the horse's skin.
Dr. Rajmir is also quick to point out many of the horses who carry this condition continue healthy, productive lives.
Horses carry a lot of bad genes, and just the way it is, you and I carry a lot of bad genes. In fact, you know, if you look at the statistics, we carry many lethal genes potentially. It's a matter of trying to diversify your genetic pool. If you've got a carrier horse, you definitely don't want to breed any cousins to that horse. If you've got a carrier and it's an outstanding horse and you still want to breed the horse, then you just need to be very careful how you pick the mares that you're going to breed that horse to. Carriers actually lead very normal lives. Carriers can actually be extremely talented individuals.
Finally, Dr. Rajmir believes the best way to prevent the condition in your horses is to be informed.
We want to be very careful about purchasing horses. Have a really good look at their back. We used to look very carefully at their legs, you know, at the way they trotted. Now we need to also look at their skin. The other thing, we need to be very careful about how we breed horses. If you just look at the horse's pedigree that you get 4 generations on a pedigree. We need to look back 8, 9 generations to see really how interrelated these horses are.
One thing to remember is that this disease can be very subtle. So as always, if you suspect any type of problem with your horse, contact your equine veterinarian. I'm Dr. Kenton Morgan, and remember, always keep your horse's health first.